Hello friends, welcome to our channel. I'm Wefafa Andrew. I request you, if it is your first time, please click the subscription button below, that red button, and by doing so you will enable me to reach as many people as possible in this fight against COVID-19. Now in this video I'm going to share about 5 facts about COVID-19. These facts will determine your knowledge about COVID-19. If you know these facts, it will really enable you to know about COVID-19. But if you don't know these facts, it means really you know very little. So just keep around. Food. I think this one is very clear. We need to wash our hands. Sometimes we wash our hands without soap. When you wash your hands without soap, you are just wetting the bacteria. You're just giving it a media to grow and multiply, but you're not doing anything. So sometimes we either wash for less time, because the recommended time is at least not less than 20 seconds. But sometimes also wash without soap. So let's wash with soap for us to be able to kill the bacteria. Avoid touching your eyes, nose, mouth with unwashed hands. That is what we call the T-zone. The T-zone. Let's avoid touching the T-zone. The T-zone should not be touched with unwashed hands, because that is the pot where the virus uses, like when it is entering our body. So another thing, stay home when you are sick. Now we need to understand this. When you have some signs, when you're feeling unwell, maybe some fever, prison should not be touched with unwashed hands, because that is the pot where the virus uses, like when it is entering our body. So another thing, stay home when you are sick. Now we need to understand this. When you have some signs, when you're feeling unwell, maybe some fever, please stay home. And when these signs worsen, you are supposed to call a toll-free number of the Ministry of Health, and the people will reach you. And by the way, when you're feeling unwell, you suspect some signs, don't be with your family members. Stay in a place where you will be alone, such that you will reduce the risk of infecting them. And if signs worsen, call the toll-free number. Then cover your cough or sneeze with a tissue, then throw the tissue in the trash. When you're coughing, you are advised to cover your face with either a handkerchief or a tissue, and you throw it somewhere in a responsible place, in a place where the children cannot pick or other people, such that you reduce the chance of them being infected. Now, lastly, fact 5. You can help stop COVID-19 by knowing the signs and symptoms. Did you know that you can help by knowing this? Now, we need to know about the signs and symptoms, such that whenever you see people with such complaints, you will be able to alert the health workers. So what are the signs? We have signs like fever. For example, the first case in Uganda only presented with fever. There was no cough, there was no shortness of breath, there was no flu. He only presented with high fever. So if you get a person with high grade fever, maybe they test for typhoid and it is negative, they test for malaria and it is negative, and he has no other underlying information. When the CBC maybe is normal, please alert health workers. Cough. When a patient coughs, when he has shortness of breath, please seek medical advice. If you see someone develop these symptoms, or if yourself you develop these symptoms, and if you've been in close contact with a person known to have COVID-19, or if you live in or have recently been in an area with ongoing spread of COVID-19, please seek medical advice when you develop such signs. Thank you very much for being part of the show. I believe more information will be coming, and you know what, I will just be uploading that information. I don't want you to miss any information. So for you to be in that position of not missing any information, just subscribe to my channel by clicking on the subscription button, like and share this video, such that you will save a life. Thank you very much. God bless you.